All right, so we're going to redo the lecture on how the body moves. And so this is going to be a lecture on the overview of kinesiology and my personal tips and tricks and information on how to understand and learn the concepts of kinesiology and how muscles move, how joints move, and all these terms and good stuff. So let's go ahead and get cracking into it. So first off, just some brief preliminary information and what I like to call foundational information in which that we essentially are going to build all the other knowledge and information that we have from. And by learning some core concepts and some preliminary information, it will hopefully help to make a lot of the other things that we're going to be looking at, the more in-depth things we're going to look at, easier. So first and foremost, what exactly is our locomotive system? We call it the neuromusculoskeletal system. These three systems of our body combined will produce the movements that we see in our body in itself. So first off, our skeletal system provides the framework of our body, as well as the shapes of the bones and the ways that these bones come together to then move around each other creates the joints. Then we have the muscles, skeletal muscle in particular, to sit on top of these muscles and attach to these muscles, which then cross these joints to then pull the bones into certain directions, which then those bones are going to pivot around each other at the points in which they touch, aka the joint, to create the movements. And then, of course, none of this is possible without the input of the nervous system, and obviously the nervous system is controlling and monitoring and regulating the contraction of these muscles and how fast it's happening and the position of the muscles, so on and so forth. So all three of these systems combined create our locomotive system, which produces our movements. Now, let's take a look at the first piece of foundational information, which is joints and the classification of joints themselves. Because when we take a look at kinesiology, kinesiology is built on three categories. First category is the bones and the landmarks of those bones. So when we take a look at the bones and the landmarks of those bones, we're going to see that those bones meet each other, creating articulations, also known as joints. The next major piece of information in the study of kinesiology are the joints themselves. More specifically about the joints, what parts of the bones come together to form the joint, and then what movements are possible at that joint. Then lastly, the biggest piece of information in this category of kinesiology will be the muscles. So first, let's talk about the joints themselves. By understanding the classifications and functionality of joints can give us the preliminary information we need to understand the grander concepts of joint movement themselves. So we have a few labels for joints. We have a structural classification and a functional classification, as we'll see in the next slide. These essentially correlate to each other, but all they do is explain either what structures create the joint or what functions those joints produce or perform. So we have three in each category in this case. We have fibrous joints, we have cartilaginous joints, and we have synovial joints. So again, this is the structural classification of joints. So this is telling us, fibrous joints is telling us that it is bound by dense fibrocartilage. An example of this would be the plates of your skull and the sutures within, or like your teeth and stuff like that. Cartilaginous joints, well, cartilage, right? So we have various types of cartilage that are going to make these joints. So such as the intervertebral joint, where the bodies of the vertebrae meet, and there's the vertebral disc, right? The intervertebral disc between them, that's a cartilaginous joint, as well as the pubic symphysis, which is, as you see in that depiction right there, where the two pubic bones of the pelvis come together. And then we have synovial joints. Synovial joints are what we're going to pay the most attention to, as these are the main focus of kinesiology, because these are the ones that are going to move a lot and have a lot of various structures. So let's go ahead into the functional classification of joints, which we have synarthrotic or synarthrosis joints, which don't move a lot at all. So we see that there's no movement allotted to them. So the plates of your skull, as we just mentioned, on the fibrous side, right, they shouldn't be moving at all, right? They might have minor degrees of size, like tectonic plate movement maybe, but nothing that we would ever care or look at. Then we have amphiarthritic joints, which offer very little movement. Mostly they're stabilized in shock absorbers. But as we know, like the intervertebral joints, right, you can bend them and they move a little bit, right? The pubic symphysis can move and expand and rotate a little bit. But it's not a lot of movement, not a lot that we as massage therapists are going to label and measure and study, right? And then we have the diarthritic joints, which are like the synovial joints, right? They move a lot. They're all very freely movable and again have all those various structures. So you're probably like, well, what's the correlation? Well, looking at this slide, you can see it's just a straight line across. So the box on your left side are the structural classifications. The box on the right side are the functional classification. You see they line up. So we can call the joints, the sutures in our skull, synarthritic fibrous joints because they're the same thing, right? One, they're made with dense fibrocartilage, synarthritic because it's telling us they don't move, right? And then the same thing for cartilaginous amphiarthritic, right? You know, cartilage is what creates them or binds them. They don't move a whole lot, right? And then the synovial diarthritic joints are the joints in which we're going to pay the most attention to here in just a moment. So honestly, you could just get into the habit of calling them that: fibrous synarthritic joints, cartilaginous amphiarthritic joints, synovial diarthritic joints, right? And then it just might make it a little bit more convenient and easy for you. So, so let's go ahead and start cracking into these synovial joints. So first, what are the structures that we're going to find in synovial joints? You know, again, we're just going to be general because this is going to apply essentially almost across the board of every synovial joint, the basics of the structures. So as you can see in this particular description, right, we're going to have two or more bones coming together. Now, obviously, we can talk about these structures on the bones. As you can see listed there is the periosteum, which is the connective tissue covering on the bone itself. But, you know, whatever, let's just focus on the main synovial structures. So first and foremost, one major thing you're going to see with any articulation, with any bone meeting and reaching out to another bone, is a layer of cartilage in between the parts of the bones that are going to almost be rubbing on each other. Hopefully they shouldn't be rubbing on each other, because that's where you get, you know, bone on bone action, and it ain't that fun kind of action. But we have this cartilage that helps with reducing the friction between those two bones as movement occurs. We call that hyaline cartilage, also known as the articular cartilage. So you've probably seen this before, right? You ever had a drumstick or, you know, a chicken wing and you ate it, and then like on the little knuckle end of the bone is that pearly white cap. Some people call it the gristle. That is hyaline cartilage. Lo and behold, eating animals is a good way to learn anatomy. Now, don't eat animals, you know, as I would say. Two sausages over there. But, you know, hyaline cartilage is what's going to help reduce that friction there, the gristle, as we can say. Then we can see that there's synovial membranes. So we talked about synovial joints, right? So we said that the structural classification was synovial. Well, what is synovium? Well, synovium is the fluid that we find inside of synovial joints. This fluid helps to lubricate, nourish, and keep the joint healthy. So these synovial membranes are the inner linings of the synovial joints that produce the synovial fluid. Then we have a joint capsule. So the entire joint is encapsulated in various types of dense dense connective tissue that are going to help maintain the integrity of the joint and keep everything together and shaped properly. Other things we're going to see within joints are tendons. Now, tendons specifically are the projections of the muscles that are going to cross over the joints to help move. And on those tendons, we have sheaths. So tendon sheaths or synovial sheaths on the tendons that help produce lubricating fluid, because, you know, we want to make sure everything is lubricated for movement, because anytime we have movement, we have friction. And anytime we have friction, we have heat and irritation, and too much of that's not a good thing. So we're trying to reduce that. We have bursas. Bursas are sacs, little pouches filled with synovium or synovial fluid that act like pillows or cushions. So usually these will be found around the joint or around the bony structures surrounding a joint that help to cushion, say, the tendons as they move, maybe ligaments as the joint moves, right, or other various structures to essentially, again, reduce friction, right? We don't want all that rubbing and tugging around on these joints, right? That's where we get into problems. Of course, then we're going to have ligaments. Ligaments themselves are the structures that are going to bridge bones together, because the difference between tendons and ligaments is, well, tendons anchor the muscle tissue, the skeletal muscle tissue, to the bones. Ligaments connect one bone to another bone. Then we'll find other cartilaginous structures, such as a meniscus or labrum. Now, typically, like the menisci are found within the knee, and the labrum, the easiest example would be your shoulder. So you've probably heard of a slap tear or a labral tear, right? That's your shoulder, or tearing your meniscus, right? That's in your knee. So sometimes we have these various cartilaginous structures within joints themselves. Not to say that every joint has a meniscus or a labrum, but those are just the common examples that will, the shoulder and the knee. Then, of course, we also need to have blood supply and nerve intervention as well, and so on and so forth. So boom, there's all the structures of our synovial joints. So the first three slides we just looked at, preliminary information and decent enough to know. But this next slide is what we really want to pay attention to in regards to understanding the movements that we're discussing throughout all of kinesiology, and particularly this video. To the point where if you know what movements each synovial joint classification can perform, all you need to know is what type of joint am I looking at? Oh, it's a hinge joint, then it only produces flexion and extension. So if we pay attention to the movements that these joints can produce, and then take a step further understanding what these movements look like, that's all you really need to know, right? That if a hinge joint can perform flexion and extension, and you know that flexion and extension occur in the sagittal plane, flexion and extension, then you're golden, right? All you need to do is like, oh, well, the glenohumeral joint is a ball and socket joint. Well, a ball and socket joint can do blah, 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 which looks like blah, 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 blah. And that's all you need to know. So instead of learning and listing out 20,000 different, okay, it's not that many, but a whole bunch of different joints, and then labeling all the movements to them, if you understand these 6 things, you understand all the other joints, right? Now, obviously, there's some joints out there that have some, cool extra rules and exceptions, but for the sakes of purposes, just understanding the basic core concept of the synovial joint types is going to get you very far. So let me go ahead and demonstrate. Now, we will essentially tie it all together later on in the video, where we talk about how movements occur in planes, right, and pivot around an axis, but we'll get to that point. So for the sake of convenience now, a hinge joint is a uniplanar, uniaxillary joint in which that we have the movements known of flexion and extension. So the easiest example of a hinge joint would be my elbow. Just like the hinge on a door only opens and closes, right? It moves only in that one plane of movement, that one direction of movement, open, close, open, close. Same thing with my elbow. Flexion, extension, flexion, extension. The interphalangeal joints of my fingers, those are also hinge joints, because flexion, extension, flexion, extension. And so this applies for all hinge joints. Now, there is only one hinge joint that is a little bit different, and that is your knee. And we call this a modified hinge joint. The reason being is that your knee, well, of course, does flexion and extension, but as my knee goes through flexion and extension, there's this slight bit of rotation. So if this is my knee, as it comes out, you can see how like it sort of pivots in and out. So there is a bit of what we call medial and lateral rotation of the knee itself. So we call this joint, the knee joint, a modified hinge joint. And the mechanism in which we're talking about is called the screw home mechanism. So essentially there's that tiny little, just that little final ratchet, the final little wrenching of that movement as the knee moves through flexion and extension. But otherwise, all of our joints are essentially the same there. Now, pivot joints are, well, if you think about what pivoting is, if you pivot, you turn on the spot. And that's what a pivot is. So pivot joints rotate. Rotation as a movement is where we turn, right? So easiest example would be like my spine. Rotation. This is pivoting, right? So turning on the spot. Now, pivoting can create different actions, such as, rotation to the left or the right. It could create internal versus external rotation, lateral versus medial rotation, pronation versus supination. So we'll take a look at that in a second. But pivot joints just turn and rotate on the spot. And again, so a pivot joint would be a uniplanar and a uniaxillar joint. So in that way, it only does one movement, right? If I turn, it's just that one degree of movement. Now, moving into the next few joints, and I'll put the thing back up on the screen until I'm done demonstrating the movements. We have the saddle joint. The saddle joint is our thumb. The big example here is the first metacarpal articulating with the carpal bone, specifically the trapezium of the carpal bones with the first metacarpal. That is a saddle joint. And it's basically like, okay, so like a horse saddle has a very U shape. Then we have the rider having a U shape in the saddle. So this just allows for what we call flexion and extension, adduction and abduction. And what makes the saddle joint so unique is that it can perform what's called opposition, which, as we know, of our hand, is to take our thumb across our hand to touch the pads of the fingers. It's not a traditional flexion extension type movement. We just call that opposition, which is to coming into this position, and then reopposition coming out of it. Then we have ellipsoidal or condylar joints, which are almost the exact same thing, just minus the opposition movement. So condylar joints, or also ellipsoidal joints, is almost like that ball and socket joint, where two condylar shapes, one knuckly part comes and rubs against another, right? So like the knuckle of our finger here, the big knuckle of our finger here, will do, well, this is extension, flexion, abduction, adduction. So, and then anytime we have those movements, we'll notice we'll have circumduction. We'll get to that when we talk about all the movements. So our next tier of joints in the synovial category is a ball and socket type joint. The easiest example of a ball and socket type joint, well, our shoulder, as well as our hip. We know that our shoulder can perform flexion, extension, abduction, adduction, and various forms of adduction and abduction, such as horizontal and oblique, as well as internal and external rotation. So it can do a multitude of movements, 3 different multiplanar, multi-axillary movements, right? And then, cool, right? And it's one ball-like structure and a socket-like structure. And then our last type of synovial joint is a gliding plane joint, which is almost like a catch-all type of joint, because the movements that it can perform are very, very, very dependent on the joint. So we can have, elevation, depression, we can have protraction, retraction, we can have rotation, we can have all these various types of movements that we're going to see here in a moment. So let me put the thing back on the board here. So again, these are the classifications of synovial joints. These are the 6 main classes of synovial joints that we're going to look at. So every synovial joint we talk about will be one of these classes. All right, so looking at our next slide, another piece of small preliminary information is how muscles work loosely. how the nervous system intervenes to create muscular contraction. Well, the nerves, a motor nerve specifically, will reach out to a muscle fiber with its little synaptic bulb and reaches a point in the the sarcolemma, or excuse me, the sarcolemma, where there's a folded section called the motor end plate, and the bulb is going to release the neurotransmitter called acetylcholine into that gap, which then will bind to receptor sites and produce the movements and contraction of the muscles themselves, which then we look at the sarcomeric contraction, where actin and myosin pull towards each other, and the actin pulls towards the myosin and creates the shortening of the sarcomere along a long chain, so on and so forth. Just a small piece of preliminary information here of what we call the neuromuscular junction, where the nervous system meets the muscular system. Another concept we talk about in kinesiology is the roles that muscles play during movement. So you've probably heard of this concept where we have prime movers, we have synergists, fixators, and antagonists and all that, right? Well, prime movers, often called the agonist, are the muscles most responsible for performing the action in which we're observing. Now, understanding the concept of action in which we're observing is very important when we're discussing this concept. Then the synergists obviously help to assist the prime mover in these movements. Obviously, if I were to synergize with something, I would be aligned or within the same parameters of that job, right? Fixators and stabilizers, well, as the name might say, they help things stay fixated or stable in place. And then an antagonistic muscle, if someone's antagonizing you, they're bothering you, which means they're doing something you don't want them to do. So let's go ahead and just give a couple examples just to keep it quick and simple. So a prime mover, again, first it's all revolved around the action in which we're observing. So let's just say we're going to observe flexion being produced at the elbow joint, right? The humeral-ulnar joint. Okay, well, flexion of the humeral-ulnar joint looks like this. What muscles or muscle is most responsible for performing flexion in this case? It would be my biceps brachii. My biceps muscle is going to pull my forearm towards my humerus, right? So that is my prime mover in this particular instance, aka agonist. Now there's other muscles that produce flexion of the elbow itself, such as the brachialis muscle, which is a smaller muscle deeper underneath the biceps muscle that will perform it, as well as brachioradialis. Those are synergistic muscles. They help to perform this action without being, as cool or bigger to do the job than you might think. Then we have fixators and stabilizers. So we have forearm muscles and other various tiny muscles in this area, which are going to help maintain the integrity of this joint during the movement so that it moves and tracks safely. Then we have the antagonistic muscle, the muscle that is going to be doing the exact opposite action than the action in which we're observing. So in this case, since we're observing flexion, well, the muscle that performs extension is my antagonistic muscle, such as my triceps in this case. Now, all of those roles change depending on what we're observing. So if I wanted to observe extension of the elbow, well, now my triceps is the prime mover in this case. It is the agonist. My synergist would be like Anconius or something like that. And then my antagonistic muscle would be my biceps. So what a lot of people get confused with is trying to make like a list of, well, what muscles are prime movers? Well, technically kind of like almost all of them, because it all depends on what movement we're observing, right? So hopefully that kind of sticks out in a good example. So let's go back to our slides and keep moving forward. So as we start to get into the muscles and understanding the movements of muscles, there's a couple fundamental rules that I want to make sure you guys understand about muscles that hopefully will help to understand the dynamics and why these movements are the movements that these muscles are producing. First and foremost is that muscles will never pull. Muscles will only pull, blank that out, and they never push. What does that mean? Muscles act like ropes, okay? And so when we look at a muscle, you're going to notice that a muscle has fibers. These fibers look like little hairs or strands, aka little ropes. And these ropes go from A to B. So if you were to imagine that I were to hand you a rope through this video, and I pull that rope tight between you and me, I pull that rope, well, you're going to move directly towards me in the exact same line and direction of that rope. I don't have a rope attached to you and something off on the side is coming towards me as well, unless I have a rope attached to it, right? And you're not coming towards me in a zigzag pattern. No, it's a very direct and straight line. Now, so that's if I pull you towards me with that rope. If I take the same rope and I try to push you away with that rope, this loose little spaghetti noodle rope, well, it's just going to coil at my feet, right? So muscles only pull, they never push. So for instance, going back to the biceps versus triceps, my biceps is just going to pull my forearm towards my humerus, right? Now you're thinking like, well, how does flexion occur if biceps isn't pushing it away? Well, muscles always exist in a push-pull relationship. One muscle pulls in one direction, and then another muscle pulls in the opposite direction to counteract that. So biceps and triceps exist in that counterbalanced lifestyle. So muscles only pull, remember that. Now, a muscle can only ever act on the joint that it crosses, right? Because it has to cross the joint to be effective. And that if a muscle crosses my shoulder joint, it's not going to act on my elbow. It's only going to act on my shoulder, right? Because it physically can't cross and move and do anything to my elbow. So origin versus insertion are the next bullet points here. I will talk a little bit about origin and insertion. I really want you guys to just understand the concepts of origin and insertion, but I'll explain why I think origin and insertion isn't something you really want to try to remember in regards to muscles. You want to at least have the idea and use the preliminary information that we're going to give you to understand and be able to identify what the origins and insertions might be of a particular muscle. The origin of a muscle is where the muscle essentially begins. And then the insertion of the muscle is where it ends. Now, let's try to clean that up a little bit. The origin of the muscle is the part of the muscle that's attached to the body that will probably move the least. And then the insertion is the part that's going to most likely move the most. Now, an easy example would be my pectoralis major muscle, my pec muscle, the chest muscle. The origins of this muscle are on my clavicle, my sternum, and my ribs here. Then it inserts onto my arm. So in this particular case, my rib cage is extremely stable. It's not going to be moving, right? And my tiny little flailing arm to the side moves a lot. So when my pectoralis major muscle contracts, it's going to pull the more unstable part or the more movable part towards the hole. Now, why I think that origin and insertion are a silly concept is that, well, when a muscle contracts, and you can put this as an extra rule since it's not necessarily on there, when a muscle contracts, all it wants to do is pull everything it's touching to the fattest center of the muscle known as the belly. Now, it just so happens that one part of the muscle that it's one part of the body that the muscle is attached to is going to move a lot versus the other side that might not move a lot. So imagine that if I was holding on to a steel beam and a rope attached to a 20-pound rock, and I try to pull both of those together. Well, clearly the steel beam's not going to move, but that 20-pound rock's going to come towards me. That's essentially how muscles are going to work. The more unstable, more mobile end will move, while the more stable end is going to. So typically, you just kind of can envision how where a muscle is based off of looking at its picture. That, oh well, this part of the body is pretty solid, pretty sturdy. So this probably is our origins versus the insertion. Now, the other two bullet points: when a muscle contracts, it pulls the insertion to the origin. That's a general concept, and again, I really don't like teaching this, but just so you guys understand the concept that insertion moves to origin might be helpful in some cases, but there is instances where that the insertion, or excuse me, the origin of the muscle can be pulled towards the insertion. We call that functional reversibility, aka reversing the function. And this mostly occurs along the spine, right? Because the origin of a muscle might be out to the side of the spine, and then attaches and inserts onto the spine, and then so I pull the spine towards me. So like the upper trapezius in this case, I can go ahead and black that out. So like the upper trapezius in this case, right, the origins of the muscle are here on the spine, and then the insertions are on my shoulder. So of course I could pull like my shoulder insertions towards the origin here, but I could also pull my spine that way. So you can see how you can kind of reverse it a little bit. But like I said, I don't really like to teach origin and insertion that much. I think it's kind of a arbitrary concept. Now, of course, the MBLEX does want you to understand what origin insertion is. And they do say that origin insertion is important in regards, and that you should know them for each muscle. But a lot of my students say that origins and insertions aren't really on the MBLEX anymore. And I hope so, because I really think origin and insertion is just a dumb concept outside of understanding what origin insertion means and understanding the concept. Because it just adds more information to what you already need to know about a muscle, in my opinion. But just to recap, remember that muscles only pull. They're going to pull A to B in line with the direction of the fibers, right? And it's only going to affect whatever it crosses, right? Origin insertion is what we just explained it to be. Now, as we start to get into these movements and understand these movements, understand that all of these movements are referenced from what's called anatomical position, which is, as we see in this depiction, is a person standing with their arms to the side, palms facing forward, head facing forward, feet facing forward. This is anatomical position. So it's essentially the map of the body. And when I tell you to drive north on a map, you have to make sure you're holding your map so that you know which way north is. Same thing when I ask you to perform flexion of a joint, well, you should assume anatomical position and then make your movements from there. So let's go ahead and get into the list of movements here. So I'll leave that up for just a second. You can take a quick screenshot of that, but then I'm going to bring it into a live view of myself as I perform all of these movements. And then, of course, I want to add at the end of this explanation of the movements, I want to add an exercise that you should be able to do probably actually at the next slide. So let's go ahead and crack into these movements. Now, I did mention before that we have these planes and these axes that we talk about. So loosely, I'll explain that right now. So a plane divides the body into different parts. So we have the sagittal plane, right, cutting us into left and right. We have the frontal or coronal plane cutting us into front and back. And then we have the transverse plane cutting us into top and bottom, superior, inferior. And then we have the oblique plane that cuts us at various angles. So flexion and extension are our first two movements, right? And flexion is a bending of a joint so that the angle between the two bones decreases and that the bones come together. So in this case, my elbow, first off, let's say this is an angle, right? This is a 180-degree angle. Well, I'm going to decrease this to 90, decrease it down to almost 0, right? So the angle is decreasing, and these bones are now coming together. So flexion is this movement in which the angle decreases, the bones come together, and I'm moving forward in the sagittal plane. Extension is the exact opposite. The angle increases, the bones move further away, and I'm moving backwards along the sagittal plane. So extension of the arm and shoulder. Now I'm going to show you this too, that if you actually do this, if you curl up in the fetal position like this, except for making sure that your toes point down like this, your feet point down like this, and your toes are curled, you do this with your hands, tuck your chin, that is the full flex position. The fetal position is the full flex position. And then if you go, oh, take your arms back, reach up to the sky, extend your backwards like that, extend your back like that, then you have the full extended position. Any joint that can do extension will be extended. So our next movements up are adduction and abduction. So the definition between those two is, well, adduction is where a structure or a movement moves closer towards the midline of the body. So like addition, we're adding towards the center. And then abduction, like subtraction, is where we're taking it away. Now there's different forms of adduction and abduction, which is, well, first at the glenohumeral joint, we have lateral abduction, lateral adduction. But we also can have horizontal, because as we see that we're in a horizontal plane. So horizontal adduction, horizontal abduction, and then we can have oblique adduction and abduction, which occur at various angles. So like of our hand, right, we can do abduction, adduction. Then we have rotation. Rotation, as we discovered and learned earlier, was a pivotal movement where we turn on the spot. So rotation can, there's several forms of rotation, right? We can have internal versus external, right? So my shoulder turning in versus turning out. We also call this medial because we're turning towards the midline, lateral because we're turning towards the outside. Now, with flexion, extension, adduction, abduction, and rotation, we can perform what's called circumduction. Circumduction is the ability to make a circular movement with one of our joints. Now, at bare minimum, we only need flexion, extension, adduction, and abduction to perform circumduction. So if you look at my finger, right, my neutral finger right here, this is one of those ellipsoidal condylar joints, the metacarpal phalangeal joint, right? If I can go extension into abduction and flexion, into flexion and adduction, probably not getting in there. So extension, flexion and abduction, flexion and adduction, extension and adduction, extension and adduction, right? And so we're just using all those movements to create a circle. Then we have supination and pronation. So supination and pronation are rotational movements, specifically where the palm either faces up, which in anatomical position, our palm or hand is supinated. So let's angle that down a little bit. So supinated, pronated, supinated. Now it's important to note that my wrist, excuse me, my wrist is not what's performing supination and pronation. If I hold my wrist like this, I can't turn my hand over. Supination and pronation actually occur in the forearm here at the the radial ulnar joints of the forearm, the distal and proximal, distal proximal joints here. So pronation, supination. So of flexion and extension, we can have a couple variations specific to the ankle, which is plantar flexion and dorsiflexion. Plantar flexion is where my foot points and plants into the ground. This is plantar flexion of the ankle, which is also true flexion of the ankle. And then dorsiflexion is where the top of my foot rears up to try to touch my shin. We call this true extension of the ankle. Then of the ankle itself, we have inversion versus eversion, which is a small part of supination pronation. So inversion is to turn my foot in, which is also supination. Eversion is to turn my foot out, which is also pronation. Let me just make sure. Oh, of course, you can't see that. So inversion, eversion, plantar flexion, dorsiflexion. Inversion, eversion, plantar flexion, dorsiflexion. So a couple more movements we can have, especially in the realms of adduction and abduction, is what's called protraction and retraction. So specifically of my shoulder blades. My shoulder blades can protract or retract. So protraction is like being proactive. If you're proactive, you're forward moving, you're going out, right? Going out of your way. So protraction is to move forward, retraction is to move back. So my shoulder blades either pull forward for protraction or bring backwards for retraction, which is a form of adduction and abduction. So protraction is actually abduction because it's moving away from my spine. Retraction is adduction because it's moving closer to my spine in this particular case. And then our last few movements are lateral flexion. Lateral flexion occurs at the spine, which means bending to the sides like this. So lateral meaning side, flexion, we're just bending to the side. And then deviation is to move side to side. And our jaw can do that, moving side, left, deviation. So let me go back in there. Sorry for the camera angles on some of the movements there, but maybe a little video editing can fix that out. But those are the movements there. So like I was saying earlier, making sure you understand core concepts, understanding the movements and what they look like, and loosely the wording responsible for those movements is paramount, right? Because if you know that if my joint moves in this direction, it's flexion. So once you start lining up that, well, if a muscle sits over here, pulls this muscle in that particular direction, then it must be flexion. So we'll see all that come together here in a moment. Now, if I were to list out some of the main joints to know and understand, it would be these. And I could probably add a couple more to this list. So we have the scapulothoracic joint, which is our shoulder blade, where the scapula meets the thorax, scapulothoracic. Then we have the glenohumeral joint, which is the shoulder joint. So that's where the glenoid cavity or glenoid fossa of the shoulder blade, the scapula, meets the head of the humerus. We have the humeral ulnar joint, which is where the olecranon process resides in the trochlea of the humerus, and then flexion extension. We have the radiocarpal, which is the wrist. We have the entire vertebral column, the spinal column, and I usually just to You know, there's several joints that are in the spinal column, but you know, I just like to lump sum all the movements into one list. Then we have our pelvic complex. Then we have the femoral acetabular, which is your hip, also known as the coxal joint sometimes. The tibiofemoral, which is your knee, and then the talocrural, which is your ankle. Other joints that I could probably list would be like your ribs, the costovertebral joints. You know, maybe like some of the hands, but these are the main joints. Like I was trying to say earlier, understanding the main core concepts is going to get us far. You know, and then you can insert smaller details here. So here's a little game I like to play, and it's a bit of an exercise that you should be performing like every day. It's almost like a stretch routine in some cases, right? Where you should be able to run through every joint of your body and perform the movements of those joints every day, right? And just run through them, talk about them, right? So let's go from anatomical position and run through it. Matter of fact, I'm going to put my stopwatch on to see how fast we can run through this. So starting from my spine, my spinal column includes several joints, including the zygapophyseal, aka the facet joint, my atlantoaxial joint, and my atlanto-occipital joints, as well as the intervertebral joints, will perform flexion and extension, lateral flexion, rotation to the left and right. My scapulothoracic joint, which is the shoulder blade articulating with the scapula, can perform elevation, depression, protraction, retraction, upward rotation, downward rotation. My glenohumeral joint, which is the articulation between the head of the humerus with the glenoid cavity of the scapula, performs flexion, extension, lateral abduction, lateral adduction, horizontal adduction, horizontal abduction, transverse or oblique adduction and abduction, and internal and external rotation. My elbow complex, which includes my humeral ulnar joint and my humeral radial joint, can perform flexion and extension. My radial ulnar joints here can perform a rotational movement, which produces pronation and supination of the wrist. My radial carpal joint, which is my wrist, can perform flexion, extension, adduction, and abduction. Adduction is known as ulnar deviation, abduction known as radial deviation. And then my fingers can perform, well, my knuckles here, the metacarpal phalangeal joints, can perform flexion, extension, abduction, adduction. And then my interphalangeal joints can perform flexion and extension. My saddle joint can perform, well, flexion, extension, adduction, abduction, opposition, reopposition. Moving into the pelvic complex, my pelvic complex can perform a lateral tilt, which is to one side lifts higher than the other, an anterior tilt, posterior tilt. My femoral acetabular joint, which is the head of the femur articulating with the acetabulum, that is the little divot in the pelvis, can perform flexion, extension, abduction, lateral adduction, horizontal adduction and abduction, oblique adduction and abduction. Can do that on one leg, right? Internal rotation, external rotation. My knee, which we discovered earlier, is a modified hinge joint, which can do flexion and extension, but has minor bits of medial and lateral rotation as it moves in and out of position. My ankle can perform plantar flexion and dorsiflexion, as well as inversion and eversion. My metacarpal phalangeal joints can do, if you could see my toes, they look like this: abduction, adduction, flexion, extension. And then my interphalangeal joints of the toes can do flexion and extension. 3.5 minutes. And I even added more joints. I was probably more of a complete overhaul of all the joints. But if you can do that several times a day, right? I mean, 3.5 minutes. Obviously, when you start out, it's going to be a little bit slower than that, right? But if you can do that 3-4 times a day, that's only going to be 15-20 minutes max of your day, right? That's a small fraction of your day. That's going to tremendously help you understanding movements of these joints. And then now all we need to do is just like, okay, well, what muscles sit to be able to pull those joints into those movements? And that's the biggest concept of kinesiology. That's the best way to understand kinesiology. And my personal opinion is to understand muscles and movements, and the correlation between the two is to exercise. Go to the gym. Like, look up a couple muscles, go to the gym, and use weights to move these joints and utilize these muscles and feel them. Go take a yoga class and do these stretches. What muscles in a stretch when I'm in the warrior 2 position, right? This, because kinesiology is that. Kinesiology is movement. If you're not learning kinesiology by moving, then you're not learning kinesiology. If you're learning kinesiology by reading words on a piece of paper and writing out the movements of a muscle without having any understanding concept of what these muscles are doing and how they're performing these movements, you're going to be lost. So kinesiology is movement. It's like a verb. Just do it. Don't sue me, Nike. So let's go back to our slides. All right, so the next few slides, which of course you can also download this on the study sessions section in your Canvas, right? And that way you can have this personal. This is just going to go through essentially what we just did, which is going to go through all the joints and more specifically, what parts of the joints are, what parts of the bones come together to make the joint, the articulation, the type of joint it is, what movements it can do, and then any important stuff like ligaments and so on and so forth. So we can pretty much just skip through these slides here. I do believe my video, does my video work? Oh, it was. So that displays the rotation in which I'm talking about. So whoever made this video, I'll hopefully give them credit somewhere. But you see how it rotates in and out of position as it moves through flexion and extension. All right, so now we're getting into muscles, and I only have a few muscles up, but when it comes to muscles, so now that we spent a lot of time, right, learning about joints and how they move, muscles, what do we do to understand and learn muscles? We just need to look at a muscle, right? And hopefully everything will line up, right? So normally people will learn a muscle by writing out what's on the board here, right? They'll write the name of the muscle, they'll write out the origin points of the muscle, the insertion points of the muscles, and then they'll list the actions. Well, what I want you to do there we go. What I want you to do is to be able to just look at a muscle, and when you look at a muscle, identify what is that muscle touching, what joints that muscle is crossing, and based off of the direction that the fibers are moving, when that muscle pulls these parts of the body together, what movements will occur? So you might notice that, well, the trapezius muscle is probably one of the most complicated muscles to start learning, just because of, one, the dynamic range of movement that occurs at the joints it can affect, plus how big this muscle is. It literally goes from the base of your skull to the bottom of your rib cage. It's a pretty large muscle, pretty long muscle. Plus, it also has various fiber directions. So normally we split the trapezius muscle into the upper trapezius, so we can usually kind of cut it off here, upper trapezius, middle trapezius, lower trapezius. So if we, let's take a look at the middle trapezius, right? The middle trapezius is going to be the easiest to understand. We can see that it's coming from the tips of the spine here, and then reaches out to the shoulder blade, right? Specifically in this case, the spine of the scapula. So if I follow the direction of these fibers, it's going to pull this part this direction, which an excellent way to practice muscles is if you have someone you can work with, especially for muscles that you can't physically touch on yourself, is to put one finger on one part of the muscle, one finger on the other part of the muscle, and trace the fiber direction, or even move that part of the body from one finger to the next to help understand what we're looking at. Now, well, that's probably going to slide, but I want to let me show you exactly what I mean. So for instance, my SCM muscle. So this is a muscle that you can obviously, touch on your own person and self. If I put one finger on one attachment site of the muscle and another finger on the other attachment site, if I move my body to try to touch the fingers closer together, well, that means that this muscle contracted. And so now it's like, okay, well, what movements occurred throughout these joints in this area for me to be able to bring those fingertips closer together? Now, obviously, it's kind of hard for me to do that with muscles on my back, but like your pec muscle, you can do that. Muscles on the body, like your rectus abdominis, I could do that, right? But maybe muscles on the back, find a partner in which you can practice with doing this particular exercise. But let me go back here. So back to the trapezius muscle. So, like we were saying, the middle trapezius was easy, right? It just retracted the shoulder blades. The lower trapezius, probably also very easy, which, as you can see, it's reaching up in a V to the shoulder blade. So that means it's going to pull the shoulder blade from here to here, which is going to, well, one, it's going to retract, right? It's going to bring the shoulder blade backwards. It's going to depress the shoulder blade because it's going to pull the shoulder blade down. And based off of the angle, it actually will rotate the shoulder blade to point upwards. Cool. Now, the hardest thing here is going to be the upper margins of the trapezius. Why? Because not only is it going to act on the shoulder blade, but it's also going to affect our neck and spine and head. So to keep it quick and short, this muscle, well, attaching to the superior nuchal line of the occiput here, and then to the acromion process and lateral 1/3 of the clavicle, is going to, one, for the shoulder blade, it's going to elevate the shoulder blade. It's going to upwardly rotate the shoulder blade. It's going to also help to retract the shoulder blade. Now, if I also add in the movements of the neck, it's kind of hard to see now, so I highly recommend that if you can, find a 3D model of the body where you can, kind of look at the muscles in a three-dimensional view, because that's going to help you show the angles a little bit better. But this muscle is going to, from here to here, it's going to pull my head. It's going to turn my head this way, and it's going to laterally flex my head this way. Now, when it comes to muscles of the spine, when a muscle rotates the spine, we have something called opposite side rotation, same side rotation. Opposite side rotation is, well, if a muscle's on the left side of my spine and turns my spine to the right, that means it's opposite side rotation. It's turning me to the opposite side that the muscle's on. versus if a muscle's on the left side of my body and turns me to the left side, that same side rotation, right? So hopefully that could be a pretty simple concept. So in this case, the upper trapezius is going to turn me to the opposite side. So the left side trapezius is turning me to the right. That's opposite side, and lateral flexion. I call the upper trapezius the Nicolas Cage muscle. You ever seen that meme with Nicolas Cage? Like, you don't say. Because specifically, you're turning your head, you're looking up, you're laterally flexing your head, and you're raising your shoulder blade. You don't say. Now, again, a pretty complicated muscle to start with, but let's go through some other muscles. The trapezius muscle is definitely an important muscle. I highly suggest you know, as well as the rotator cuff muscles. So there's 4 rotator cuff muscles. We use the acronym SITS to define them. We have supraspinatus, infraspinatus, teres minor, subscapularis. Essentially, the name of the muscle all tells you exactly where all of these muscles are. Supraspinatus is in the supraspinous fossa of the scapula. Infraspinatus in the infraspinous fossa. Teres minor is on the lateral border of the shoulder blade. And then subscapularis is on the subscapular fossa. These are essentially stabilizers of the shoulder, but supraspinatus can abduct the shoulder. Infraspinatus and teres minor are going to laterally rotate and abduct the shoulder. Adduct the shoulder. And then subscapularis is going to medially rotate. Another big muscle player, I say, is the levator scapula, specifically understanding the differences between the upper trapezius and levator scapula. They're going to have some common movements, such as elevating the scapula. They're going to have common movements of laterally flexing the head, but levator scapula is going to downwardly rotate the shoulder blade and rotate the head to the same side. So understanding the antagonistic relationship between upper trapezius and levator scapula, in my opinion, are going to be very important. Now, again, hopefully you're seeing the concept here. I want you to be able to take a look at just the picture of the muscle. Now, when you understand what bones look like and learn what landmarks of those bones look like, you should be able to identify that the levator scapula is attaching to, well, the superior angle of the shoulder blade, and then is reaching out to the transverse processes of cervical vertebrae 1, 2, 3, and 4. And now that means that we're going to affect the spinal column, and we're going to affect the scapulothoracic joint. So when this muscle pulls these structures together, what's going to occur? Well, in this case, right, my spine is going to move to the shoulder blade, lateral flexion. My shoulder blade is going to move to the spine, downward rotation and elevation. And, based off of the angle, like I said, you can't really see the full range just on a 2D image. So get a 3D model of muscles if you can to see the proper angling of it. And notice that it rotates to the same side. Other muscles, the erector spinae muscles, specifically, one, erector spinae are going to extend the spine. That's their main job. But a couple fun facts is, know the order in which they come. The spinalis muscle is the most medial of the muscle group. Longissimus, as is the superhighway, rides the longest distance, is in the middle. And then the most lateral muscle is the iliocostalis because it reaches out to the ribs. So a couple extra fun facts is that, the iliocostalis, because it's in the name, the costalis, costal ribs, this reaches out to the ribs, which can help to assist with exhalation of the body, which I actually left that out. The costovertebral joint, your ribs, can elevate and depress. Elevation of the ribs is where we inhale. Depression of the ribs is when we're exhaling. So I'll put that little piece of information in there. Forearm muscles. Now, when it comes to forearm muscles, instead of learning every single forearm muscle, This is my general guide of rules for learning forearm muscles. If you remember these few simple, easy rules, you can learn any forearm muscle. Because forearm muscles come in two groups, flexors and extensors. Flexor muscles come from the medial condyle. Extensor muscles come from the lateral condyle. Flexor muscles are going to flex the structures that they're involved with. Extensor muscles are going to extend the muscles that they're involved with. The name of the muscle should tell you everything you need to know. For instance, flexor carpi radialis. Well, first off, it says flexor, so that means that it's coming from the medial side. It's going to flex the wrist, and radialis in the name means that it's attached to the radial side of my hand, which means probably the second or third metacarpal. And with radialis in the name, it means it can perform radial deviation. On the flip side, flexor carpi ulnaris, it's on the ulnar side of the hand and performs ulnar deviation. So these few rules are all you're going to need to know outside of maybe the names, I guess, of the muscles about the origins, insertions, and actions of those muscles in themselves. But always remember the thumb moves completely independent. The thumb has its own movements, and that's even easier because the movements of the thumb, or the muscles that move the thumb, have the name of the movement and then thumb in the name. Now, the technical name of the thumb is pollicis. So we have abductor pollicis, adductor pollicis, extensor pollicis, flexor pollicis, right? So anything with pollicis in the name is going to be thumb. Another big muscle is the sternocleidomastoid, which I kind of just demonstrated for you guys. Coming from the mastoid process to the clavicle and the sternum, it's going to perform lateral flexion, rotation to the opposite side, and flexion of the neck. And now, technically, based off of the angle, it does perform minor extension of the first couple cervical vertebrae, but whatever. And then moving into the scalenes, we have essentially a mirror to the sternocleidomastoid. The scalenes being, just a little bit deeper into the neck, attaching to the transverse processes, and then the first rib or two, are going to essentially perform flexion of the head and neck, lateral flexion, as well as rotation to the opposite side. So they're almost like a mirror of the scalenes. The quadriceps muscles, right, are muscles of the front or anterior part of the thigh, include vastus lateralis, vastus intermedius, and vastus medialis, as well as rectus femoris. A couple big things to know is that, well, one, collectively, all of these muscles are responsible for extension of the knee, and only rectus femoris crosses the hip, which means that rectus femoris can perform flexion of the hip. The other parts of the quads only work on the knee itself. Then we look at the hamstrings, the counter opposite, right? So all of these muscles come from the ischial tuberosity, which is the bone on the bottom of your pelvis, the little sits bone. And then we have three muscles in this group that are going to go to either side of the knee. We have biceps femoris, which goes to the lateral side, which has two heads because it's biceps. Biceps mean two heads. So both of those heads go to the lateral side of the knee. And then the semi-muscles go to the medial side of the knee. And how I like to remember this is that, well, there's two muscles, semitendinosus and semimembranosus. One, what is the order from medial to lateral of these muscles? So, well, biceps femoris going to the lateral side is the most lateral. The hard thing is to remember between semimembranosus and semitendinosus, which one is more medial than the other. Well, if you look at semimembranosus as a word, semimembranosus has more M's, meaning more medial. That's just my personal take on that. And yeah, so obviously they're involved with flexion of the knee, extension of the hip, and then they can do minor bits of rotation, medial versus lateral, which help to assist that screw home mechanism we were talking about. And then lastly, we have the lower leg muscles, which again fall in the same pattern that the forearm flexor muscles with. First off, we have tibialis muscle, we have extensor muscle, we have a hallucis muscle and a digitorum muscle. On the anterior side, we have tibialis anterior, we have extensor digitorum, and we have extensor hallucis. Hallucis meaning big toe, just like pollicis meaning thumb. And then on the back, we have tibialis posterior, flexor digitorum, flexor hallucis. And again, they follow similar rules. So dorsiflexors are on the anterior side and perform extension. So that includes, the first three: tibialis anterior, extensor digitorum, and extensor hallucis. Plantar flexors are on the back, right, which is flexion. And then all of these muscles are going to perform inversion of the foot, with the one exception that out of all 6 of these muscles, only one performs eversion, which is extensor digitorum longus. And that's it. So very quick, short, sweet rules to live by. So let me go through a final recap, right? So like I said, understanding kinesiology revolves around 3 major boxes, 3 major categories. One of which is being able to know where bones are, be able to identify what bones are through an image, and identify the landmarks on those bones. Then understanding the joints, where they are, what bones come together to make the joints, and then what movements are performed at those joints, which we can insert the foundational knowledge of, well, what are these movements, right? What is the nature of these movements? Flexion, extension, all that good stuff, right? Then when it comes to muscles, all I want you to be able to do with muscles, if you've learned the previous 2 boxes and categories, you should only be able, with just looking at an image of a muscle, be able to identify what bones it's touching, what joints it's crossing, and then based off of the fiber directions, how it's going to pull the body to perform XYZ movements. And I assure you, once this really clicks with you guys, kinesiology is the easiest concept there is in all of this course. I've obviously, been studying this a lot, but it's to the point where I can look at the anatomy of other animals. I'll flex my knowledge a little bit and pull up the anatomy of a cat or a dog and be able to identify, because that's not very unsimilar to us. One, you can see the shape of a joint and identify, well, it's probably a hinge joint because of what structures are coming together. And if this muscle attaches here to here, it's going to bring this together. So that's probably flexion. Lo and behold, I'm usually correct. So I'm telling you that, like, if you really, really take the time to hopefully, and hopefully I explain this well enough, really take that time to get these core foundational concepts of kinesiology in. It's so easy. And to the point where, like I said, when we look at muscles, right, we make that chart, the origin, insertion, name, actions, all that. I mean, that's a spreadsheet. Nobody's to remember in spreadsheets. When I explain muscles to people and I recall muscles and explain these actions and movements of muscles, the image of that muscle pops up. And when that image of the muscle pops up, I have everything I need, right? And that's how our brains as human beings work. We don't remember big, long spreadsheets and text messages and words and long paragraphs. We remember images and lyrics, and we remember poems, right? Short information or images stick better. So being able to visualize a muscle and visualize how that muscle's moving is far more important and more real and important and better for you in the long run. And so, of course, my biggest examples for exercise of the learning of kinesiology, one is to do that movement game I did earlier in the video, right? So you go run through all the joints like flexion, extension, right? We can even take it a step further and start labeling what muscles are going to move that joint into certain movements if you really wanted to. Try not to overly complicate it. But go to the gym. Pick a handful of muscles, right? Like, oh, well, my pec muscle does this and this, and go to the gym. Use light weights if you don't know what you're doing, and just like a 2-pound dumbbell or something, just to feel the connection between the movement and that muscle to really understand that it's doing what it's supposed to be doing. Go take a yoga class, do some stretches, or look at a stretch or a yoga pose and be like, oh, well, what muscles are lengthened when I'm in this position, and what muscles are tightened and short in this position, right? And that to me is probably going to help you the most, hopefully. So I'm gonna think I'm gonna end the video there, and then we can just have a couple questions.